generally speaking, back pain affects a huge portion of people at some point throughout their lives. It's the persistence of back pain which can be, one, life-limiting, reduce enjoyment in life, and have a significant impact on people's mental health. Not one thing is going to sort all those parts out, but if we can reduce the pain, then the negative connotations with regards to maybe the weight gain that's happened because of inability to function properly in exercise, that can be addressed, and that hopefully will result in an improvement in people's self-belief, self-worth, their confidence, and impact positively on their mental health. Your normal pathway for being referred in for lower back pain would be to see the spinal surgeons, and so they will then, in essence, work up the likelihood of what the cause of the pain is, work you up with regards to investigations, commonest of which is either an X-ray and an MRI scan. Once you've seen the spinal surgeons and they've deemed it appropriate to perform some interventions, so you've had your injection, you've had a positive response to the injection, you then come to us for the denervation. So facet denervation is using heat or thermal heat to ablate the nerve endings that supply the facet joints in the back. And the purpose of which is, if you have no nerve endings that sense pain, you don't feel the pain. With lower back pain, there are multiple causes for it, and it can sometimes be difficult despite the various tests we can perform, including an MRI, which would give us an indicator of what's the likely cause. They can be due to multiple reasons. So to try and eliminate which one is the actual cause of your pain, we almost always perform an injection initially into those joints to see if there's relief and how much, sort of a relatively quantitative effect of how much there is improvement. And if we get a good improvement, it doesn't tend to be for that long. It can vary from a week to a few months, rarely beyond that point. And that would then indicate we can then step up to the more prolonged response that we get from facet denervation. So we almost, they're not thought of as either or, it's kind of quite a symbiotic relationship. We would use an injection to make sure that we are going to get a good response with the denervation, and the denervation is the one that we would perform to give you a more sustained response. So Benenden is a great place to come because you also have a great team. So we have the full array of specialists you'll require. So fantastic spinal surgeons who will be the initial port of call. Then they will refer you most likely for an MRI. And then either you'll be seen by a physiotherapist or by myself for either an injection or the denervation procedure. What we would do is you bring you in on the day of the procedure. It's a day case, so you will be with us for approximately 4 to 6 hours. You come in, you'd have a cannula placed in your hand, and that's what we give the sedation for. So you're then assessed by the person who's giving you the sedation, assessed by myself. You're consented, so we go through the consent process. Any questions you have, I'll answer them at that time. You will then come into the CT scanner. So I use the CT or CAT scan to guide us in. That's an open donut, so it's not the same as an MRI. People generally have no claustrophobia related to it. You'll be lying on your front for the procedure. We place markers on the back. The CAT scan then performs a scan of that specific area. From that, I'll be able to see exactly where I need to place the needles into position. You'll have local anaesthetic, so the area will be cleaned up. You'll have local anaesthetic into the skin. There's some minor stinging, same as when you go go to the dentist for that. Needles go into place, you're scanned to confirm they're in the right area, then we put the probes in. And at that point, we then do, what I want to do is test that we're going to get the right area. So we do two tests. First one is the sensory test, so making sure we're going to get the nerves that sense pain. So we stimulate sensation related to each of the areas. Once we've done that, we want to make sure we're not going to get the motor fibers, so the ones that supply muscles. So we only want to get the ones that sense pain but not supply muscles. So we perform those two tests. That's the safety portion done. Then we have the sedation, and you're very much nice and relaxed at that point. It's what we call conscious sedation, so it's not a general anesthetic because that carries no insignificant risk all by itself and deemed unnecessary. I've had patients unable to tolerate this procedure under sedation. So we give you the medication for the sedation and the intravenous painkiller. Most people wish you to either drift off slightly or just be very comfortable. And then it's a 3-minute ablation itself, so that doesn't take particularly long. Once that's done, everything's removed. You're then placed into recovery with our recovery nurse, taken back to the ward, and generally in about 2 hours' time after that, depending on how well you respond, sometimes a little bit longer, you have something to eat and drink, stand up, make sure everything is fine, and then go home. Key part to this is you can't drive, so don't drive yourself here and then be worried how you're going to get home. So make sure you've got someone who is going to take you here and back. Most people will have a bit of or mild degree of bruising, a bit of soreness afterwards. Very occasionally, you can get some numbness of the lower back and legs, or inadvertent sort of nerve injury. But this is partly why the tests are so important. That really minimises the risk of that happening. If that happens, it's very temporary and it will resolve within a few days. We're now ablating nerves, so we're waiting for the nerves to die off so they can be inflamed after the procedure, and it can take up to 2 weeks to settle down. So you may get some discomfort and some soreness related to it. We just advise you to take whatever painkillers you normally take for your lower back pain. And the key way to look at this is obviously the length of, or how long people's improvement lasts for can vary from anywhere between 6 months to 18 months. I've had patients who come back to me 4 years later for a secondary denervation treatment, and it's lasted 4 years. And invariably that the nerve endings would have grown back far earlier, but the acute inflammatory component, i.e. the pain part, hasn't happened. So it's not that the nerves didn't grow back, the nerves did grow back sooner, but they've had a more sustained response because the inflammatory component wasn't there. And I would very much advise people to use this as a pain-free period to get their core stabilizers strengthened and to help support the back and reduce the risk of ongoing back problems. So very much use this as a stopgap to be pain-free, because the difficulty you have when you have lower back pain is you want to exercise or you want to do some sort of Pilates or back strengthening or core strengthening exercises, but you're in pain and every movement causes exacerbation of that pain. So this is very much a stopgap to alleviate that, to give you the window to try and get your core stabilizers strong. So with facet denervation, it isn't a one-stop shop. It can be used as chronic management of back pain, and it varies on how quickly your nerve endings grow back. So if you have a very good response from the treatment and it lasts a year, then I have patients now who I've been seeing for 6 or so years now. I've been performing this procedure for 10 years. So I've been seeing them for a long time. They have their year and a half denervation and have a completely normal function of life in between, which they didn't have before. So it isn't a one-stop shop. It can be repeated as required.